Yep, yep, yep. You heard that right. We can now look up a doctor's cesarean rate anywhere in the country. Some will have them, but they are working to add more. But I'm excited to share that this is actually a resource on the Improving Birth website. We partnered with Amino that basically reviews insurance claims to determine look at their cesarean rate. So I'm actually going to show you live. I've failed miserably at my 21 days live. After the website launch, I pretty much fell off the face of the earth a little bit, and it was difficult to motivate myself to continue doing it. But I think I'm picking up here so that I can share this cool resource with you. So I'm actually going to go onto the website and show you how to do it. Hold on. Okay, hopefully you can see that. It's adjusting. All right, so this is the new website. It looks beautiful. If you haven't seen it yet, it's pretty cool. Lots of cool things here. The statistics, there's a little video here about us. The accountability toolkit, I've been talking about this like crazy. This is essentially a guide to file complaints. Anyways, I'm going to get to my point. If you haven't checked it out, we have a ton of cool stuff on here. So make sure that you go to ImprovingBirth.org. So this is the home page. When you click the resources button, it takes you to the resources page. This has the toolkits. It also has evidence, facts, rights with links out to information for pregnant people and related articles. And right here, what is your doctor's C-section rate? Amino basically reviewed this. This is they've taken the last 2 years of non-public insurance claims information. So in other words, it doesn't reflect Medicaid patients. So they adjust the risk for also doctors who deal with high risk and sicker patients so that their cesarean rates don't basically come up negatively or as negatively. So you come here and I'm going to go through the process. So it automatically populates pregnancy because this is what our people are probably looking for. You can do this for lots of different things. This is optional to tell them what your orientation is. I'm just going to put in a number. I'm definitely not 35. I'm going to put in Encinitas, California, which is near where I live. And you can do this. You can actually put your health insurance in here to find a doctor that takes your insurance, which is amazing, right? So then you can pass through this if you want to. I'm going to just do optional. 29 matches. So now it gives you a map of where all these providers' offices are located. And I'm just going to take this first one. And this thing comes up and you can book an appointment through this process. You can contact them, you can review them, you can look at their costs. But if you just scroll down, it tells you the conditions they treat. It gives you an cost estimate of those things that they do treat. And here it is, C-section rate for this doctor, which by the way, when I looked this up earlier, was significantly less than I had anticipated. And one of my favorite providers, I'm not even going to say his name, actually had a 30% cesarean rate. So I'm going to be giving him a call and having a conversation with him about that because I'd like to understand why that might be. Oops, sorry, I clicked on something. So you can look at their different office locations. I mean, there's really a lot of information. You can look at their Yelp reviews are in this platform. And this is a resource right on the ImprovingBirth.org website. So it takes 2 years worth of information. They're constantly updating this resource about where the cesarean rates. And, I don't know how 100% accurate it is, but I can tell you that it's at least a start, right? And then there's all these little filters up top that you can change things. You can look for doctors that have higher than predicted rates, similar to predicted, or lower than predicted. You can actually see here about the add the insurance carriers and hospital affiliation. So if you're like, I know a lot of people in San Diego are in, like they're in the Sharp system or the Script system, so they can actually do this and pick that, and they can pick the doctor's gender that they would prefer. So I don't know about you, but I think this is kick ass. And such a great resource for families. If there's one thing that I've talked about many times is that, transparency is going to be the answer to improving maternity care. One of our local hospitals here, in San Diego actually started posting the cesarean rates of all the doctors in the hospital in their doctor's break room so that everyone could see each other's cesarean rates. Because, as a doula, and I'm sure there's midwives and doulas on here that will tell you that most providers, even within the same practice, have no idea how their partners are practicing. No clue. And because they're not in the same room, where the nurses and the doulas and probably some of the midwives know exactly how they're practicing. Anyways, so I just think this is an incredible resource, and I think a lot of people missed it on the launch of the website, and so I really wanted to highlight it. So when you go, again, the ImprovingBirth.org website, scroll and hit the resources page and scroll down, people can now search their provider cesarean rate. This is good all across the country. So, or a provider cesarean rate, or they can just look at all the providers in their community and find the one that has the lowest. I think that it is the beginning. It's the beginning of everything that could change. So please share this video. Share this video in all those mama groups, the pregnancy groups, the birth groups. Like, we need to be sharing this so that women can start looking for their providers instead of just saying like, oh, how was your provider? Who was your doctor? Let's give them the tools to find a doctor that, they know has a low cesarean rate to at least increase their chances of having a normal vaginal delivery. So we know, and I want to address low cesarean rates versus high cesarean rates. We know that the higher cesarean rates actually show worse outcomes for babies and moms, but lower cesarean rates do the same. So this is not about no cesareans. We need cesareans. We know that they save lives, but we also know that there are too many of them, and that we have to figure out and strike a balance. And, I believe that balance starts with just reducing the induction rate. That alone would make a huge dent. So if you are just joining me or just joined me in the last couple of minutes on our website, our new website, ImprovingBirth.org, if you go to click on the resource page, you will find a search feature to look up a doctor's cesarean rate. So please share this video everywhere. Thank you so much. And I'd love your feedback on it too. And the website overall, I'd really love to hear from you and tell me what you think. Thanks so much. Have a great afternoon.